about something that's in pretty much every caregiver's medicine cabinet, paracetamol syrup. We're going to break it all down so that by the end of this, you'll feel totally confident using it safely and effectively every single time. You know the scene, right? It's the middle of the night, your little one is feeling warm, they're fussy, and you just know they have a fever. So you head to the medicine cabinet and reach for this bottle. It's a moment that plays out in homes all over the world, but have you ever stopped to wonder, what do we really know about what we're giving them?
Okay, so let's get to know this household staple a bit better. And a good place to start is, well, what do we even call it? Because I'm guessing you've probably heard a few different names.
So you might call it paracetamol, which is common in many parts of the world, or maybe you know it as acetaminophen, which is what you'll hear in the United States. Here's the thing. It's the exact same active ingredient. All those brand names, Calpol, Grocin, Tylenol, are just different packages for the very same medicine. Now, you've probably seen two common strengths on the shelves, one that's 125 milligrams per 5 ml, and a stronger one that's 250 milligrams per 5 ml. This isn't random, I promise. The different concentrations are there to help you give an accurate dose more easily, whether you've got a tiny infant or a bigger kid. So how does this stuff actually work its magic? How does a simple syrup bring down a fever and make your child feel better? Well, the science is actually pretty cool, and it's probably not what you'd expect.
Get this. Paracetamol's main stage of action isn't where it hurts. It's in the brain, the body's central command center. It works by telling the brain to slow down the production of chemical messengers called prostaglandins. These are the little guys that signal pain and crank up the body's thermostat to cause a fever. Paracetamol just tells them to take it easy.
And this brings us to a really key difference between paracetamol and other common medicines, like ibuprofen. While paracetamol is a rock star for pain and fever, it has very weak anti-inflammatory powers. Ibuprofen works all through the body to reduce inflammation. Paracetamol, on the other hand, is more of a specialist that works in the brain. This is also why it's usually gentler on the stomach. Whoa, okay, a chart like this can look pretty intimidating, right? But you don't need a medical degree to get the gist of it. All this complicated diagram is really showing is the chain reaction that paracetamol interrupts. The most important thing to know is that it stops the signals for pain and fever right at the source, the brain. All right, everybody, lean in. If you take away only one single thing from this entire explainer, please make it this next part. This is the absolute key to using paracetamol safely and getting it right. It's the question every single one of us has asked, probably while standing bleary-eyed in the kitchen at 3 a.m. How much do I actually give? Do I just follow the age guide on the box? What if my kid is big for their age, or on the smaller side? And here is the answer. The single most important factor for getting the dose right is not age. It's your child's current weight. Age is just an estimate, a ballpark figure. Weight is precise. This right here is the golden rule. The recommended dose is 10 to 15 milligrams of paracetamol for every single kilogram of your child's body weight. You should memorize this number, 10 to 15 milligrams per kilogram.
So how do you put that into action? It's just 4 simple steps. First, know your child's weight in kilograms. If you only know it in pounds, no problem, just divide by 2.2. Second, multiply that weight by 10 or 15. That number is the correct dose in milligrams. Third, you can give that dose every 6 to 8 hours as needed. And fourth, and this is vital, never give more than 60 milligrams per kilogram in a whole 24-hour period.
Now, I know talking about rules and numbers can feel a little intimidating, but this isn't about creating fear. It's about building confidence. Understanding how to use this medicine safely empowers you to care for your child in the best way possible. So let's start with a really reassuring fact. When you follow that weight-based dosing rule we just covered, paracetamol is an extremely safe medicine. Honestly, millions of correct doses are given safely all around the world every single day. However, and we have to be super clear about this, giving too much can be incredibly dangerous. A paracetamol overdose is not something to take lightly. It is a true medical emergency that needs immediate attention. An overdose can cause severe, sometimes irreversible liver damage. It's a condition called hepatotoxicity. And what makes it so tricky is that the early symptoms might be misleadingly mild, like just a bit of nausea. You might not realize the danger. One of the biggest risks is accidentally double dosing. Giving your child paracetamol syrup and another cold and flu medicine that also contains it. You have to check the labels. Now, the good news is that there is a very effective antidote, but it's not something you can buy. It has to be given in a hospital, and it works best when it's given as soon as possible after the overdose. So if you ever even suspect an overdose might have happened, don't wait. Get medical help immediately. Okay, finally,
let's just quickly cover a few specific situations where you need to be extra cautious, and you should always talk with a doctor before giving this medicine.
You should always consult a doctor first if your child has any known liver problems, like severe liver disease or hepatitis. Of course, if they've ever had an allergic reaction to paracetamol, you shouldn't use it. And you'll want to be extra careful with children who are malnourished, because their bodies may process the medicine differently. And this all really highlights why the liver is so important in this conversation. Think of the liver as the body's main processing plant for paracetamol. If that plant isn't working right, the medicine can build up to toxic levels much more easily. So a healthy liver is absolutely key to using paracetamol safely. There's a famous quote that says it all, really. The difference between a medicine and a poison is the dose. Paracetamol is a fantastic medicine that brings comfort to millions. But just like anything, the line between helpful and harmful is all about the amount. Getting that dose right is everything. And now you have the knowledge to use this tool with confidence. The next time you're reaching for that bottle in the middle of the night, you'll know exactly what to do. You'll ask the right question, not how old are they, but what's their weight? Because that single number is the key to turning this bottle into a safe and powerful tool to help your child feel better.